If you notice the implant industry over time, manufacturers have been introducing wider and wider diameter implants. And now there's a category of implants called the ultra wide diameter implants, and these are typically implants which are 7, 8, or 9 millimeters wide. Now you may be wondering, why do we need such ultra wide diameter implants? Well, the main application for these implants is immediate implant placement in molar sites. Remember, a molar tooth is quite big, it's quite large, mesiodistally, buccolingually, and an implant is quite small in comparison. So the idea here is to use this ultra wide diameter implant so that you can engage the walls of the bony socket once that tooth has been extracted. So typically you won't use ultra wide diameter implants when you have a healed ridge. It's usually for immediate placement. Now, is there a size that's too big? Before we get into that, let's talk about some of the advantages. You reduce the use of your grafting material because the implant is wide, there's less place to put grafting material, and thereby reduces your cost and the patient's cost. You're potentially avoiding a second surgery because you're placing the implant right away. You don't need to wait for it to heal and then again go in and do another surgery. All of this saves time, it saves money, and overall there's a faster return to normal function. Now, there are some disadvantages, especially if you don't have enough bone, if your walls are very thin. I wouldn't recommend you place an ultra wide diameter implant because you want at least 2 millimeters of walls on either side to give you long term stability. And of course, there is always a doubt whether these types of implants can cause increased crestal bone loss, and that remains to be seen. But now, comparing 7 millimeter, 8 millimeter, 9 millimeter implants, which one is the most effective? Is there a difference between these sizes in terms of survival? There's a retrospective paper just came out in February 2023 in the Journal of Prosthodontics. This is by Will and Drago, and they analyzed 540 patients over a span of 12 years. And what did they find? When they looked at the survival rates of the 7 millimeter, 8 millimeter, or 9 millimeter, the 7 millimeter was the highest at around 97.6%. The second highest survival rate was the 8 millimeter, which was 94.4%, and the 9 millimeter was 91.1%. So what does that tell you? This tells you that you just can't keep going as wide as possible. There is a certain limit where you're going to keep increasing the diameter of the implant, but you're going to keep getting diminished returns. And it seems like the magic number right now is around 7 millimeter. In fact, in this paper as well, they saw that there was much more success with the 7 millimeter, so they changed the protocol midway during the paper, and only if the 7 millimeter implant did not engage the socket did they then intra-op change to an 8 millimeter to engage the socket. But otherwise 7 millimeter tended to be their first choice because they also noticed the trend of the 7 millimeter implants being more successful. So guys, this is just another tool in your armamentarium. There are a couple of companies which already sell these ultra wide diameter implants. Understand the science, understand the biology, and I'm sure you're going to have a lot of success. I hope I've confused you enough. This is the Dental Review Guy signing off with a smile.